Hi everyone, my name is Alexandra Rands and I'm the director of the Mental Health Support and Relief Program that takes place in Las Vegas, Nevada. I'm hosting this workshop today to talk to you about mental health, what it means, and how we can get the help we need. Firstly, the Mayo Clinic defines mental health as the overall wellness of how you think, regulate your feelings, and behave. Sometimes there may be occurrences that disrupt how we are feeling that can cause some serious changes emotionally and cognitively. There are some points to consider when wanting to know if it's time to seek professional help. If you have a family history of mental health, it could be important to talk to a doctor, especially if any of the following symptoms are present. You could be experiencing changes in your personality or your behavior. Perhaps you're having greater mood swings that are more intense than normal. This could also include excessive anger or anxiety. If you have low moods or feelings of sadness for more than 2 weeks, or if they worsen after 2 weeks, it's also a sign that it's time to talk with a doctor. Substance abuse or even suicidal thoughts could be very important warning signs to look out for as well. There are a couple of questions that a doctor or other professional might consider when diagnosing a patient with a mental health condition. Many of these points are included. There are many treatment options for mental illness, and it can be very important to find a treatment that is going to work for you. Sometimes it can take more than one try to find a treatment that shows improvement, and when you are struggling already, it can be hard to want to continue trying different approaches. But don't be afraid to try new things. It can be very beneficial in the long run. One method can prove to be successful with many different types of mental illness include therapy. There are many different therapy options including psychotherapy, individual therapy, group therapy, behavioral therapy, and several more. Although there is a bad stigma about therapy, therapy can prove to be very successful, especially for patients looking for options other than medication. Sometimes medication is necessary in order to help cope with symptoms while trying to get better. There is no shame in taking medication, and it can show great improvement and mental clarity for those with long-term struggles. Having support from family and friends can be a great motivating factor when trying to improve your mental health as well. Group therapies and support groups can also be helpful support systems, so you don't feel like you have to overcome difficulties alone, and you can hear from other people experiencing the same things as you. Some other therapies that can show improvement for symptoms include yoga, meditation, or other types of exercise. I wanted to practice a meditation with you guys today. I'll go ahead and start playing it and just follow along.
Mindfulness of breath. 3-minute breathing exercise. To prepare for this exercise, just take a few moments, whether you're sitting or standing, just to find a comfortable position. You may choose to close your eyes or keep them open. If you're feeling a bit tired, it may be useful to let just a little bit of light in to keep you alert. Begin by gently moving your attention onto the process of breathing, simply observing each breath as it happens, whether you focus on the rise and fall of your chest or abdomen, or perhaps the sensation of the breath as it moves in and out of the nostrils. Are the breaths deep or shallow, long or short? Really feel what it is like to breathe, without feeling the need to alter your breath, just observing it as it happens. As you engage with this exercise, you may find that your mind wanders, caught by thoughts or by noises around the room or bodily sensations. When you notice that this happens, know that this is okay and that our mind often wanders. Simply notice what has caught your mind's attention, then gently bring your focus back to the breath. You may find as you watch your breath that it begins to change, or stays at a steady pace. Whatever your breath is doing, just watch it in this moment and feel what it's like to be breathing. Again, if your mind wanders, it may do so many times. As you notice that your focus has moved from wish to simply label the distraction as thinking or as a feeling or as sensations or noise, then just gently bring your attention back onto the process of breathing. As we move towards the end of this short exercise, I invite you to allow yourself to be really aware of your next few breaths, focusing on every sensation as the breath comes in and as it flows out. Take a few moments to yourself just to feel really connected with the present moment. Now, as you feel comfortable to do so, you can expand your awareness from the breath into the rest of your body and the room around you. And when you feel ready to do so, you can open your eyes and bring the exercise to a close.
Hope you enjoyed that meditation exercise, and hopefully that's something you can try at home. Being there for those struggling with mental illness is very important. It can encourage someone to receive help before it's too late. Make sure to talk to someone in a place where they are going to feel safe and comfortable with no other interruptions. Sometimes people may be unwilling to talk about their feelings out of embarrassment, and it can be very important to respect their boundaries and talk to them with kindness so they can feel they can talk to you with confidence. Don't press them for too much information, or it can scare them from talking to you again in the future. It's helpful to be sensitive towards their feelings so that they can feel understood and that their feelings are important to you. Don't blame them for feeling the way they do. It's also important to not make them feel like everyone else feels the same way so they don't have to feel that way. Everyone has a unique experience and copes with it differently. It's also important to not tell them to just change their attitude or behavior. Being more positive or not moping around won't necessarily fix the problem. Everyone needs a friend, and in these circumstances, it can be crucial. Lastly, I wanted to share with you a list of the emergency hotlines for several different types of mental illness. If you don't see the mental illness you need help with, there is also a link to a website with more mental health hotlines that are there to help. Don't be afraid to contact them. They are willing to listen and they want to help you get the proper help and treatment that you need. Thank you for listening to my workshop today, and I hope you have a wonderful rest of your day.